All right, let's talk about something tiny but mighty. We're going to dive into a small gland in your neck that has a massive job, your thyroid. It might not look like much, but believe me, it has a huge impact on your well-being. So let's get into it. Ever have those days, or maybe weeks, where you just feel completely drained? You're sensitive to the cold, your brain feels a bit fuzzy, and you can't quite figure out why? Well, while those are common feelings, they could also be your body trying to tell you that something's not quite right with your thyroid. So, what we're really digging into here is a condition called hypothyroidism. Now, hypo just means under or low. So, simply put, this is when your thyroid gland is underactive. It's just not producing enough of the crucial hormones your body needs, and the result is that your whole metabolism starts to slow right down. So, here's what we've got on the cards for this explainer. We'll kick off with the thyroid's crucial role. Then, we'll look at what happens when things slow down with hypothyroidism. After that, we'll cover diagnosis and management, investigate thyroid lumps, and finally, we'll touch on the rarer, more serious conditions. Right then, first up, the thyroid's crucial role. And a great way to think about it is as your body's engine control unit. I love this analogy. It just makes so much sense. Just like the control unit in your car's engine, your thyroid is basically in charge of how fast your body burns energy. It's managing the speed and power of pretty much everything, from your heartbeat to how you digest your lunch. When it's working properly, the whole system just hums along beautifully. But if it slows down, well, the entire system really feels the knock-on effect. Okay, so what actually happens when that engine starts to slow down? Well, that's when we get hypothyroidism. And the thing is, the signs can be incredibly subtle, so let's have a look at how to recognize them. Because your metabolism is slowing down, the symptoms can pop up all over your body. On the outside, you might start to see things like puffiness around your eyes, or maybe your skin and hair feel really dry and coarse. And then there's how you feel, that persistent fatigue, maybe gaining weight even though your habits haven't changed, or just feeling cold all the time. It can even affect how your body works physically, leading to things like a lower-pitched voice or even carpal tunnel syndrome. The key thing is, these symptoms often creep up on you over months or even years, which can really start to impact your work, your mood, and your relationships. And this right here, this really hits the nail on the head. Because symptoms like fatigue and weight gain are so common, they often get brushed off as just stress or getting older or just, life. And that subtlety is exactly why hypothyroidism can be missed, which makes being aware of it so, so important. Now, I know all those symptoms might sound a bit worrying and vague, but here's the really good news. Getting a diagnosis is actually very straightforward. It all comes down to a simple blood test and a clear plan to get things back on track. And this is the key tool to get to the bottom of it, a thyroid function test, or TFT. It measures two main hormones, TSH and T4. Here's a simple way to think about it. TSH is a message from your brain, basically shouting at the thyroid, hey, get to work and make some more T4. In primary hypothyroidism, the thyroid just isn't listening, so the brain shouts louder and louder, which means your TSH level goes way up, but your T4 level stays stubbornly low. That's the classic calling card of an underactive thyroid. And the great thing is, the actual journey to getting help is super straightforward. It all starts with a chat with your GP about how you've been feeling. They'll sort out the blood tests, and once the results are in, you can talk about a treatment plan, which is usually just a daily tablet to replace the hormone your body is missing. So the blood test can show a couple of different things. Think of it like two stages of engine trouble. First, there's overt hypothyroidism. That's the classic high TSH, low T4 we just talked about. But you can also have subclinical hypothyroidism. In this case, the TSH is high, the brain is still shouting, but the T4 level is just about managing to stay in the normal range. It's like the engine is straining but hasn't conked out yet. This might cause milder symptoms, and your doctor might decide to either keep an eye on it or maybe suggest a trial of treatment to see if it helps. Okay, let's switch gears a bit and talk about something else that can affect the thyroid, lumps, or what doctors call nodules. Finding a lump in your neck can be, quite worrying, so it's really important to understand how they're investigated. Right, first things first, and this is really important. Take a look at this chart. The vast, vast majority of thyroid nodules, we're talking well over 90%, are benign. That just means they aren't cancerous. Only a very small fraction turn out to be malignant. So that's a really reassuring place to start. When a doctor is having a look, they're really seeing it from two perspectives. On the left, you can see the external sign, a visible swelling that's called a goiter. And on the right, you can see what the doctor sees with an ultrasound.
That scan is the single most important test. It lets them get a really close look at the nodule's size, its shape, and all of its features in detail. And this whole process is incredibly methodical. It's not guesswork at all. This table lays it out perfectly. It starts with that blood test to check how the thyroid is functioning overall, then the ultrasound to look at the lump itself. If anything looks a bit suspicious on the scan, the next step is often what's called a fine needle aspiration, or FNAC, which is just a biopsy to collect a few cells for analysis. And based on all that information, the plan could be as simple as just observation, or if it's malignant or causing problems, then surgery might be on the table.
All right, for our last section, we're going to touch on the more serious end of the spectrum, but I want to stress what we're about to talk about are the much, much rarer conditions.
First up is something called myxoedema coma. Now, this is a real medical emergency, and it's caused by severe, long-term, untreated hypothyroidism. As you can see here, it's a perfect storm of a drop in consciousness, severe hypothermia, and a dangerously slow heart rate. It's usually triggered by something else like a bad infection or certain drugs in someone whose thyroid has been underactive for a very long time.
And this is why it's taken so seriously. A mortality rate as high as 50%. It really just hammers home how absolutely critical it is that hypothyroidism is diagnosed and managed properly, long before it could ever get to this severe state. Now, when it comes to thyroid cancer itself, there are a few different types. As this chart shows, the vast majority, about 80%, are papillary thyroid cancer. Follicular is the next most common, and then way down at the other end, you have anaplastic carcinoma, which is very aggressive, but thankfully also very rare. But let's end this section on a really crucial positive note, because while any cancer diagnosis is serious, the prognosis for the most common type, papillary cancer, is excellent with the right treatment. In fact, for younger patients with smaller tumors, the outlook is a near normal life expectancy. That's fantastic news. So we come full circle, right back to that engine analogy. Your thyroid is your body's engine. And sometimes when it starts to run a little bit rough, it sends out these subtle signals. The key is just to listen to your body, to understand what those signals might mean, and to feel empowered to have that informed chat with your doctor. Thanks for watching.